Brucellosis, Brucellosis, Febra da Malta, undulate fever, Mediterranean fever, Malta fever, gastric ruminant fever, Gibraltar fever, Banks disease, epigenetic abortion. एक ग्राम नेगेटिव होता है स्मॉल, नॉन मोटाइल, नॉन स्पोरुलेटेड, नॉन टॉक्सिजेनिक, नॉन फर्मेंटिंग, facultative, intracellular, Coccobacillus having flagella, endospore and capsule are absent, although capsule-like structure have been reported. Species Bioware reservoir host identify pathogenicity to human. Brucella melanosis 1-3 sheep and goat. Bruce 1887 high may lead to epidemic. Brucella abortus 127 and 9 cattle, buffalo, camel, yak. Banks 1897 moderate, usually sporadic. Brucella suis, swine, render, murine rodent, desert wool rat. Trauma 1914 high non-reported, high moderate non-reported. Brucella canis, canine, Chemichiel and Burners 1968 high. Brucella ovis, ram, Van Dremelian not reported. Brucella neotomy, desert wool rat, Stoner and Lachman not reported. Brucella pinnipedialis, mink whale, dolphin seal, Ewald and Rose 1994 not reported. One of the world's major zoonotic disease that still is of veterinarian, public health and economic concern in many parts of the world. A different type of fever considered by fairly regular remissions or intermission was observed at the Mediterranean coastal areas in the time of Hippocrates in 450 BC. In 1861, J. A. Morton, an assistant surgeon of the British Medical Department working in the Mediterranean, first described the symptoms of brucellosis in himself as gastric remittent fever. The cause of this disease was obscure until 1887 when Sir Davis Bruce, Scottish physician, reported numerous small coccal organisms in eastern section of spleen from a fatally infected soldier and isolated the organism in culture from spleen tissue for other British soldiers stationed at Malta. Professor L. F. Benhard Bank, a Danish veterinary pathologist and bacteriologist, 1987, with strict bolt isolated the small bacillus now known as Brucella abortus. Brucellosis is the most common zoonotic disease in the world and report more than 5 lakh cases annually. OIE reported that North America, Northern and Central Europe, Canada, Japan, Australia, New Zealand, Southeast Asia, and Oceans are free from the disease. Economic losses in India due to brucellosis in cattle and buffalo was to the sum of Rs 240 million every year. In India, the circumstances are favorable for widespread human infection on account of unhygienic conditions and poverty. Brucella abortus bovyer first has been reported to predominate in cattle in organized farm, while biotype third has been frequently reported to infect the cattle in the unorganized animal farm or village animal. Most important foci of epidemiology: poor farm hygiene, unrestricted trade movement, local cattle yard and fairs, seasonal maintenance of animal, artificial insemination with infected semen. An acute or subacute febrile illness marked by an intermittent or remnant fever accompanied by sweating, malaise, anorexia, headache, arthralgia, backache, anorexia, prostration which may persist for weeks or months. Brucellosis can be transmitted through milk and dairy product, especially cheese product from unpasteurized milk. Stain smear, stain smear, gram stain, modified kosher and modified gel Nelson stain technique are used to stain the organism from the smear of placental side, cotyledon, vaginal discharge, fetal stomach contact, semen, etc. The staining is non-specific and it is tough to differentiate between the similar looking microorganisms. Culture most commonly used medium is the feral medium contain antibiotics to inhibit the other bacteria and supplemented with 10% CO2. Some bioware or species do not require CO2. Molecular method demonstration by validated polymerase chain reaction PCR of the presence of Brucellosis genetic material in blood or other tissue sample. Primer for the gene specific insertion sequence IS711 or IS650 or section of the 16S to 23S RNA BCPS31 and OMP2A genes may be used. Serological test. Serological test. No single serological test is applicable in each and all epidemiological situations. All have limitations, specifically when it comes to screening individual animals. Rose Bengal plate test (RBPT) screening of brucellosis is done by this internationally accepted tool. Standard tube agglutination test (STAT). STAT is the most widely used test for diagnosis of brucellosis. The test is having lack of sensitivity and specificity. Complement fixation test (CFT). CFT is by far the most successful of conventional tests, having good sensitivity and specificity. ELISA, a universal indirect ELISA that can recognize antibodies to Brucella with both smooth and rough LPS, was recently published. Milk ring test (MRT). MRT is used in pulled milk sample detect the infected herd in 3-4 times annually. Milk ELISA. The ELISA may be used to test bulk milk is very sensitive and specific, enabling the detection of single infected animal in large herd in most situations. International test. This test using a standard antigen preparation such as Brucella INRA or Brucellosis OCB can be considered for monitoring the status of herd in brucellosis free area. It is sensitive and specific, but false positive reaction can observe in vaccinated animals. The general method of control of brucellosis consists test and slaughter hygienic measures and vaccination. Brucellosis can be prevented over a period of time by one-time vaccination of all eligible female calves. In human, the use of proper protective measures while handling the infected livestock prevent the disease transmission to a great extent. Test and slaughter strategy. In case of bovine brucellosis, this policy is most effective. RBPT is used as screen test followed by testing positive sera with complement fixation test CFT for confirmation. In case of cattle milk ring test, MRT could also be used for identify infected herd with decent result followed by sero testing of individual animals. Immunization in cattle. Presently, there are two vaccines accessible that are effective enough and inexpensive. These are live attenuated Brucella abortus strain 19 for cattle given individually at full dose 10 into 10 CFU, subcutaneous once in lifetime, and Brucella melitensis strain REV first for small ruminant sheep and goat given at full dose 1 into 109 CFU by the conjunctival route at the age of 3 to 6 months. Sexually mature female animal. Both vaccine can be hazardous to human and also may induce abortion when vaccinating pregnant animals. The designation of the antigen is culture composed of smooth and rough colonies are shown in the table. The production of monospecific antisera to A and M antigen can be used in the Identification of the Brucella species. Brucella canis and Brucella ovis grow as rough colonies that do not possess either of the surface antigen A and M, but instead of that they have R antigen. National Control Program on Brucellosis NCPB NCPB. Under the 12th 50-year plan of India, NCPB was introduced in the country for mass vaccination of all female calves between 6 to 8 months to reduce the impact of brucellosis on human health and to reduce the economic losses. In 2019, the program was designed and recognized under National Animal Disease Control Program (NADCP) to control and eradicate the foot and mouth disease (FMD) and brucellosis. Under the NADCP, it aimed to vaccinate 36 million female bovine calves for 8 months annually to control brucellosis in livestock by 2025 and eradicate this by 2030. Erythritol trigger abortion in ruminant. Ruminant placental is composed of multiple placentomeres which are formed by the combination of the maternal caruncular endometrium and fetal cotyledon. The presence of erythritol, a 4-carbon polyol in fetal tissue of ruminant has been established. Erythritol play an important role in the tropism of Brucella for the pregnant uterus of ruminant. High concentration of erythritol have been shown to stimulate the growth of Brucella melitensis and Brucella abortus. Thank you.